Hello, good participants and listeners from around the world. I'm Kristen Schwartz, licensed midwife and MC here at Gold Learning. And here at Gold, we're ready to prepare for our package that we are recording here. It is the Preventing and Healing Perinatal Trauma Lecture Pack of 2020. And with me here today is one of our speakers, Sarah McNamee. Hello, Sarah.
Hi, how are you?
Good. It's so wonderful to have you here with us today.
Thank you. I'm happy to be here.
So, Sarah, tell our listeners a little bit about yourself. First of all, where in the world are you located?
Yeah, I am in Colorado in the United States, right outside of Denver.
Mhm. And how is it there right now for you in your practice? Tell us a little bit about your background. You
Yeah.
are in private practice there as
Mhm.
well. So, tell
Yep.
us a little bit about your work and your life there in Colorado.
Great. So I have a group practice. Our name is McNamee and Associates LLC, and we specialize in infant and early childhood mental health. So there is a team of 7 folks who do mostly in-home work with babies and their families, and young children and their families, which has changed a little bit in this time since March.
Mhm.
Still seeing families. And then we also provide supervision for folks who are mental health providers, as well as for folks who come from other disciplines,
Mhm.
who work with babies and young children and families. And that supervision and consultation can be both clinical and also reflective supervision, which are 2 different things. And then I personally, most of my work is doing that supervision and then some training and some consulting. Um, and I also am a parent of 3 children. And so right now, some of my work is also that parenting piece that has gotten bigger with all that has been going on in the past 6 months.
Absolutely, absolutely. So tell us a little bit about the supervision part. What can we understand under that?
Yeah, so for supervision, when I'm speaking about clinical towards versus reflective supervision, so clinical is really going to be based off of for those folks who are doing infant and early childhood mental health as well as
Mhm.
perinatal mental health. And so it's a lot of times for folks who are working towards their full licensure.
Mhm.
In Colorado, we've got a couple of different mental health licenses that folks are able to obtain. And so we provide some supervision specific to that.
Uh-huh.
Um, and then, so really when I'm saying clinical, it's around, what are the theoretical frameworks? What lenses are we using to view our clients, the families and the children that we're working with and that we support? And then from that space, what are the different types of interventions that we might be doing? How
Mhm.
are we really supporting that mental health specific work?
Mhm.
And then the other type of supervision that I am really passionate about and do a lot of work with, not just mental health folks, but also, like I said previously, folks from all different types of disciplines, is reflective supervision. And so reflective supervision is different in that we aren't exploring what are the theoretical frameworks, what are my interventions, right? Like what we're really being able to do in reflective supervision is co-create a space, whether individually or in a group with a facilitator and a supervisee or a consultee, that gives us the opportunity to slow down, to kind of step back and explore what is coming up for us in our work.
Hmm.
How is that impacting the interactions and the experiences that we are having with the families that we support, with the clients or the patients that we have? And then what do we do with that, right? And so we're looking a lot at exploring the emotional content that comes up, for ourselves, while also thinking about what could possibly be the experience for the other person or other people that we are in relationship with.
Mhm.
And one of the things that I really, really appreciate about reflective supervision, especially specific to the infant and early childhood mental health space, is that although we are doing that for ourselves as providers and thinking about our relationships with others, we are always holding the baby in mind, right?
Yeah.
So any of the information that we are speaking to or the feelings, whether they be emotions or body sensations that we're getting in touch with and kind of listening to, or the possibilities that we're exploring about somebody else's experience, we are always doing that with the goal of holding the baby in mind in
Hmm.
order to best support parent and child relationships, in order
Hmm.
to best support the growth and development of that baby or any specific or given baby.
Absolutely. It sounds absolutely fascinating. Also, this reflective practice there that you're describing. I can imagine anybody working in mental health, especially working with families and
Mhm.
small children. There's a lot coming up, right, for
Yeah.
them, and the emotional part is, of course, big.
Mhm.
So that might also trigger something for the health provider,
Yes.
or and how to kind of integrate that, and keeping, of course, most foremost, the baby and the family in mind there as well. That can be a challenging thing to do, and so these reflective practices are probably extremely beneficial for that work group, right?
Yeah, and I would say that actually, I mean, most of the folks that I support through reflective supervision or reflective consultation are actually not mental health folks, right?
Mm,
They are folks who come from other disciplines like nursing or PT, physical therapy or occupational therapy or speech therapy or early childhood care and education or home visiting, who, so any person, I mean,
mhm,
in my perfect world, any person who touched the lives of pregnant people and people who have new babies or young children would be able to receive reflective supervision to really have that space to feel held and to be there together and have a space that they trust, that I can put forth the things that are challenging for me, the things that feel successful,
mhm,
and I'm not doing it by myself, right? And so my cup isn't always full and running over, and so I
right.
can be more present, I can be more intentional, I can think maybe a little bit differently about the reasons behind why a parent is responding to me in a specific way, or why a client is responding in that way, or why I'm responding to them that way, and
Mhm.
have the space to possibly shift how those interactions and those responses and those experiences are going.
Wonderful. That sounds very interesting there indeed. You and I chatted a little earlier about, you mentioned we're living in challenging times, and how much of our trainings or has shifted
Mhm.
online, and
Yeah.
education, of course, too. So tell me a little bit, are you doing much online work now with your clients and your groups?
Everything that we are doing is currently online. So we have been doing televisits as well as telesupervision and virtual training since the middle of March. And that is where we are staying at this point in time.
Mhm.
There are challenges for everybody in doing
Right.
that. And we've been really trying to figure out how to be as flexible and supportive as possible for all the families that we support and serve, as well as thinking about how do we, or I'll speak for myself, how do I show up best in supervision spaces where I'm used to being in the same room and face to face with somebody. And or in training spaces where I'm used to that kind of almost immediate feedback, right? Or being able to pick up on facial expressions a little bit more than I'm able to in a training or a supervision virtually. But we're figuring it out, and sometimes it's really challenging, and we just keep trying and we keep going.
So it is a learning process, really, right?
Yes, yes, definitely.
Absolutely, absolutely. Is this something that you're experiencing now in this time? Are you thinking like this is really the online part is really good? It has some positive effects too. Do you see any of that as well?
Yeah, one of the beautiful things actually is that I was utilizing online um, platforms prior to COVID, so it wasn't
Mhm.
brand new for us. And one of the
Right.
things, when specific to reflective supervision, that I am able to facilitate is that we've used it to support folks around the state of Colorado.
Hmm.
So instead of folks having to worry about driving somewhere or not having access to a reflective supervisor or consultant, we've been able to utilize the virtual platforms as a way to still connect folks.
Right.
I know in the infant and early childhood mental health field, people are using it virtually or have been to connect folks from different states as well in the United States. So, I think that has been a part of it. We've always also had the option to provide telehealth visits for our families.
Mhm.
So some families really wanted that, especially during cold and flu season, right? So
Right.
for some of the families that we support, their babies or young children may have different medical needs that there is a concern of having somebody come in at a certain time
Right.
or you know, and so we didn't have to stop seeing families because we couldn't go to the home. We were able to continue services
Hmm.
um, in a virtual way.
Hmm.
So I feel like we were kind of set up to be able to move into that, which was nice. And
Yeah.
um, it's also different to do all of it, right? So
Hmm.
I think we are the other piece that I think we have heard from, again, the reflective supervision piece and even the training piece, that some of the trainings that tended to be in a specific area and others couldn't get to it, now they have access because it's virtual. So I see it opening up access for a lot of
Mm.
folks, um, while also thinking about for folks who may not have the resources or the internet or that type of access, how are we supporting them
Mm.
in getting the support and the training and the information that they are needing at this point in time too? The other thing that I appreciate with the platform that we've used is we have the option for simultaneous interpretation. And so if we have families who um, speak a different language than one of our providers does, we're able to have an interpreter still with us. If I'm doing training or any of us are doing training for folks who speak a different language than I do, or I speak a different language than they do, right? That ability to have that simultaneous interpretation right there feels like it's opening up access as well.
That's a very interesting point, a really important point as well. So
Mhm,
it's, increasing access there as well,
mhm,
especially what you just mentioned with the language, having an interpreter there and also being
mhm,
able to provide for families with little ones who have medical needs and
mhm,
where you're not able to go into their home, or on the other side, it is difficult for them to take a little one with medical needs to a different location as well.
mhm,
So I'm glad to hear that this is
mhm.
also opening access there as
Yeah,
well. That's fantastic.
yeah,
Um, so tell us now a little bit about the presentation that you will
sure.
be giving here at Gold, and
Yeah.
yeah, what will you be speaking about, and what can we expect?
Yeah, so I will be speaking about reflective practice
Mhm.
and the ways in which it supports folks in providing trauma-informed care. So the little piece about it that always feels important to me to put in terms of reflective practice is thinking about our regulation. So in addition to kind of a very beginning conversation around what are the principles of trauma-informed care, what is reflective practice, we're going to spend some time thinking about regulation, our regulation, um, and others' regulation, and how does that then impact our ability to show up in a reflective way, our abilities to show up in a trauma-informed and culturally responsive way, and then also thinking about what are the things that we can start to do today that may support us in a more intentional way of supporting our regulation to be able to show up more purposefully, more intentionally, in a more present way with anybody that we are with, right? The families, the patients, the clients that we work with, our colleagues, our supervisors, our supervisees. So kind of we're putting in a bunch of things that to me all fit under the reflective practice piece. And it's going to be really a pretty little bit of an introduction to each of them with
Mhm.
the hope that it sparks some curiosity and some interest in folks. And so they want to learn more. Um, the beautiful thing for me about reflective practice is that it is co-created. So it's not just me telling somebody what to do, right? And so it's us figuring it out together. And with this being a recording, my attempts at kind of having that co-creation space are a little bit different
Mhm.
in that I'm going to be asking folks to engage in some individual reflection on their own
Right.
that will hopefully then kind of support them as they move forward again to think about how might I be thinking about my work differently, or to even validate, wow, this is how I'm thinking about my work. This is what I'm doing and engaging in. And yeah, this is really supportive for me.
It sounds fascinating, especially the co-creative aspect of the session there, and that our delegates then are able to, come up with maybe learn something about themselves that they can take into sessions then or into their work as well for themselves.
Yeah, that is my hope. I believe that we bring all of us, every one of us brings immense amounts of knowledge.
Uh-huh.
And so in that co-created space, my hope is always to welcome in that inherent wisdom we come with and
Right.
think about how do we use that? What do we do with it? And what are we able to come up with together from there?
Absolutely. Well, thank you so much, Sarah McNamee, for sitting down here with me and chatting, and I'm looking forward to your presentation.
Thank you.
Mhm. And now for our listeners, how the presentation, how you are, is as important as what you do. The importance of reflective practice in providing trauma-informed care is part of the Gold Preventing and Healing Perinatal Trauma Lecture Pack of 2020. The lecture pack will be available on October 5th, 2020. There will be 6 expert speakers delivering 6 hours of accredited information. And to learn more about this presentation and the other presentations in the lecture pack, you can visit goldlearning.com. And if you have any questions or comments for us, you can post them below. Thank you, everyone. And thank you again, Sarah, for spending time here with us today. Bye bye, everyone.